Apparently, construction workers already had the highest on-the-job death toll of any industry, but now they are being affected by something totally unrelated to their work. In 2021, the U.S. Bureau of Labor Statistics reported over 5,000 fatal work injuries. Of those deaths, almost 20% were in construction. Now the CDC has an analysis of some data from 2020 that says there were more than 162 overdose deaths per 100,000 construction workers. Based on that, the Department of Labor decided to compare those numbers to an on-the-job construction deaths in 2020, which was about 10 workers per 100,000. And what does all that mean? Well, basically, it is saying that construction workers are 16 times more likely to die of an overdose than a work-related injury. This is sad, interesting, and unexpected all at the same time. But how does this even happen? Well, if you think about it for a second, it does start to make sense. But the reason they are on the addictive opioid medications that are causing overdoses is because they are managing pain from work-related injuries. Safety has to be the highest priority on these job sites. If you are an employer that manages safety-sensitive employees, you can always get in touch with us by filling out the form below. Construction sites have all kinds of safety protocols in place to avoid injuries, or at least they should. But ultimately, things happen. And when those construction workers are in recovery and trying to get back to work, that is when the issue comes in. Most of them are most likely prescribed strong medications, and they're simply using it to mask the pain so they can get back to work. They do have to pay the bills. And it's all good, because the doctor prescribed it, right? Well, maybe. These drugs can be highly addictive, especially when they're overprescribed or abused. Sometimes a person doesn't even know the dangers of the medication until it's too late. If you watch our videos and read our articles often, you've probably heard us talk about drugs pretty regularly, and one of the drugs we have discussed is fentanyl. Not long ago, we were talking about the possibility of fentanyl being added to the drug testing regimen for federally regulated employees. Why? Well, fentanyl overdoses have become a huge issue in the past years. It's an opioid that is 100 times stronger than morphine. We'll throw that link above so that you can check that out. But let's get back to our construction workers. You remember that little issue we had with the opioid prescriptions from 1999 to 2014? Well, in that time, opioid prescriptions quadrupled and prescription opioid overdose deaths increased at a similar rate. One year, it was found that 240 million prescriptions were written for opioids in 1 year. Think about that for a second. At the time, that would have been enough prescriptions to give every adult their own bottle of pills. And the results were more deaths from overdoses. In general, it was just medications that were being overprescribed and a lack of understanding of how dangerous these drugs could be. According to the CDC, in 2017, the opioid crisis claimed 64,000 American lives, and in Pennsylvania, the drug overdose mortality rate doubled from 2014 to 2020. So how do we help control this issue for construction workers? Well, help is going to have to come from the top, and the CDC has a few recommendations for employers. Number one, make sure workers have full health benefits. That should offer coverage for injuries, physical therapy, mental health, and even substance abuse. Number two, if a worker is injured on the job, give them paid time off. Number three, have open communication about how employees can avoid misusing opioids and other pain treatments they can talk to their doctors about. Number four, employers can establish a work environment that makes workers feel comfortable talking about issues, whether it be related to mental health or substance abuse. Number five, larger companies can create internal employee assistance and peer support programs. Number six, for smaller employers, you can work with community-based organizations to get workers the help they need. In addition to some of the things I just mentioned, employers can also expand on their drug testing policies that are already in place by testing for synthetic opioids. Back in 2018, the DOT added 4 opioids that are regularly abused. Those were hydrocodone, hydromorphone, oxycodone, and oxymorphone. It is also helpful for managers to understand reasonable suspicion in the workplace and how it can help workers stay safe, which is something that is required for DOT-regulated employers. Check out the link above to some videos that talk about what reasonable suspicion is and how managers can use it properly. Typically, managers should be looking for signs and symptoms like slurred speech, unsteady walking, difficulty completing routine tasks, confusion, or just unusual behavior. This applies in all workplaces, but is even more important when considering safety-sensitive employees because using prescription or over-the-counter medications could affect their ability to perform their jobs safely. As an employer that manages safety-sensitive employees, you need to have a drug testing policy in place as well as a workplace safety plan. These can be complicated and they really need to cover you from all angles so you can avoid any potential lawsuits. If you manage safety-sensitive employees, want more information on a supervisor reasonable suspicion training, or if you just have general questions, call, email, or fill out the form below and one of our occupational healthcare specialists will help you out.